These are drugs that we are going to discuss later on in the CNS in details. So these are drugs are that are important for the treatment of which kind of nausea and vomiting. Uh,
Anticipatory.
yes, thank you so much, Faiza. Thank you, Amir Faiza. Anticipatory nausea and vomiting. Anticipatory nausea and vomiting is has a different mechanism as we mentioned just now before in the beginning of the lecture. So we need a different strategy other than the dopamine receptors antagonist, other than the serotonin 5-HT3 receptor antagonist. We need a different pathway to block. We need to block the pathway of the cerebral cortex, which can directly trigger the executive center, the vomiting center, which is the executive part of the pathway of the vomiting pathway. Yep. Corticosteroids are add-on therapy because corticosteroids they have been found to improve appetites in general, wherever they have been used in other diseases, like for example for the treatment of bronchial asthma or for the treatment of uh, SLE, systemic lupus erythematosus. Yeah, any of the diseases that are considered as collagen diseases or connective tissue diseases or autoimmune diseases, these corticosteroids will end up with the patient having increased appetite. The mechanism is still not clearly understood, but it has been linked to the reduction of the synthesis and the reduction uh, of the action of prostaglandins in the brain. Reduction of synthesis and reduction of the action of the prostaglandin in the brain. So these are highly lipid soluble agents that can penetrate the blood-brain barrier and that can affect the prostaglandin level and the prostaglandin action, ending up with a better appetite. And for patients who are already suffering from nausea and vomiting, improvement of appetite will end up with reduction of their suffering from nausea and vomiting. There are add-on therapies. They are used in combination with either butorphenols or metoclopramide or the highest efficacy serotonin receptor antagonist. A relatively newer agent that binds to neurokinin 1 receptor, and as I mentioned to you, neurokinin 1 is a receptor in the CTZ that binds to substance P. And substance P, the more substance P binding to neurokinin to NK1 receptor, the more is the stimulation that can happen at the level of the CTZ and can be triggering the vomiting center at a higher level. So, by blocking the NK1 receptor, binding to substance P by using this aprepitant, by using this synthetic agent, aprepitant, we can stop this cycle. We can block the cycle of triggering the CTZ to send signals, to stop it from sending signal stimulation of the vomiting center. So these are, in general, the general classification. Okay. So this is what. Yes. Okay. Anybody wants to say something? Okay. So this is the what I have just mentioned that there are two important zones or centers. The first one is the CTZ, which lies in the area postrema. Area postrema is outside the blood-brain barrier. Thus, it can respond directly to chemical stimuli in the blood or the CSF. While the vomiting center is the executive center of the vomiting pathway, it's located in the medulla, the lateral reticular formation of the medulla, coordinates the motor mechanisms of vomiting, and it responds to afferent input from the vestibular system directly, as I mentioned, in motion sickness, and from the periphery, from the GIT and the pharynx, and also from higher centers, brainstem, cortical structures, as we have mentioned in anticipatory vomiting. Yep. So this is how we should understand the mechanism, so that we can understand the mechanism of vomiting, so that we can understand the antiemetic mechanism. So, using anticholinergic drugs, for example, here, especially the anti-muscarinic drugs, okay, we use scopolamine for the treatment of motion sickness. For the treatment of motion sickness, because for motion sickness we try to uh, target which nucleus? The vestibular nucleus. In motion sickness, we want to target and block the receptors at the vestibular nucleus, which are H1 receptors and muscarinic receptors, anticholinergic, by using anticholinergic drugs. Scopolamine is a drug of choice, and it's available in is the drug of choice, and it's available in transdermal patches. So before traveling, we can prescribe, we can advise the patient to buy the transdermal patch, take a transdermal patch, and then attach it to the skin and start traveling peacefully without having any motion sickness, nausea, and problems. Or we can prescribe H1 receptor antagonists. That is specifically the first generation, like diamine hydronate, amiclazine, and cyclazine. All these are very useful in motion sickness, but they are ineffective in a substance stimulate that can directly stimulate the CTZ. Yeah, so these are very effective in blocking or stopping motion sickness, but not chemotherapy-induced nausea and vomiting. Yep, because of different kind of receptors at the CTZ as compared to those at the vestibular nucleus, as we mentioned in the beginning. So the phenothiazines are a group of drugs that are antiemetic agents, and also they are anti-cytotic agents. And the representative of that group is prochlorperazine. Prochlorperazine, and then they are effective in low to moderate emetogenic chemotherapy agents, like against can be used for the treatment of nausea and vomiting as a result of fluorouracil and doxorubicin. Doxorubicin and fluorouracil, those are the anti-cancer drugs which have moderate uh, emetic activity, moderate nausea and vomiting producing action. Yep. Side effects can include hypotension from these phenothiazines. It includes restlessness, and as I mentioned, because they cross the blood-brain barrier, they can cause Parkinson-like extrapyramidal side effects. Okay, extrapyramidal symptoms because of blocking, because unintentional blocking of dopamine D2 receptors at the basal or the basal nuclei or the basal ganglia. Yeah, the highest efficacy antiemetic agents are that play a very important role in treating every nausea and vomiting as a result of chemotherapy. These include ondansetron, granisetron, halonosetron, and the lacitron. Okay, these can be administered as a single dose prior to chemotherapy, intravenously or orally, and they are very highly efficacious. It can prevent up to 60% of cisplatin. Cisplatin induced nausea and vomiting. Cisplatin is the anti-cancer agent, which has very high emetic vomiting, nausea and vomiting activity, producing activity. Yep. They selectively block the 5-HT receptors in the periphery, the viscera, as well as in the chemoreceptor trigger zone. Okay. So the lastron is extensively metabolized by the liver to metabolite, which is hydroxydolacitron, which is also active. So that makes the lastron a longer duration of action anti-medication. has a long duration of action. And the elimination at the end after being metabolized by the liver, elimination is through the renal system. Um, the disadvantage and the side effect is that they can produce headache, okay, and they should the dose should be reduced in patients with hepatic insufficiency because the liver is the site of metabolism. So in case of in case of hepatic, yes, in cases of hepatic insufficiency, we need to reduce the dose in order to avoid having toxic level of having the drug reaching toxic levels in the blood. Prolongation of QT interval, the lacetron, is a drug that leads to this uh, serious cardiac side effect. Okay, you need to trigger arrhythmia, cardiac arrhythmia, and of course, these drugs, as I mentioned, are more costly than the other agents like the dopamine receptor antagonist. Substituted benzamides includes methylclopramide. As I mentioned, methylclopramide is also a prokinetic agent. Okay, that is effective against in blocking about 30 to 40% of vomiting that is resulting from cisplatin. Okay, less efficacious than the 5-HT3 receptor antagonist, but still it can block 30 to 40% of vomiting from anti-cancer drugs, cisplatin. Antidopaminergic side effects will include sedation, diarrhea, and extrapyramidal symptoms similar to the phenothiazines. Deuterophenones are moderately effective antiemetic drugs. These include droperidol and haloperidol. These are antipsychotic agents used for the treatment of psychosis initially, but they are found to also block the dopamine receptors at the CTZ and leading up to reduction in nausea and vomiting as a result of anti-cancer agents. They also can prolong the QT interval, okay, and the high dose of haloperidol was to be nearly effective as high dose of dopamine in preventing the highly emetogenic cisplatin-induced emesis. Benzodiazepines, we said they are GABA receptor stimulants, which include lorazepam and alprazolam. These are drugs that are used for treatment of anticipatory nausea and vomiting. Their antiemetic potency is considered to be low because they do not stop, they do not block the CTZ. Mm, somebody waiting.